Hello and welcome to our new series of You Ask, We Answer, where we answer some common clinical questions that have come through to us at Oscar. I'm Anita Morton, I am the clinical support nurse for Oscar.
And I'm Valerie Daly, I'm an independent tissue viability specialist that works with Oscar.
So let's have a look at our first question. So the first question that's come through to us is, at what point do you step a person up onto an air mattress? So Valerie?
Well, I think the most important thing firstly is that we have a good baseline assessment, a good baseline pressure ulcer assessment in place so that we can care plan. And on top of that, that we communicate effectively with our patients so that they are aware of why we're moving them on to more specialist equipment. So it ensures that the knowledge that the patient has the knowledge and that we take their preferences into mind when we're looking at any change.
I think really, I suppose as a rule of thumb, we would look at stepping somebody up onto an air mattress if their condition changes at all or if they deteriorate. It may be that they've become high risk or very high risk. And they may have developed either a Cat 3 or a Cat 4 pressure ulcer, which means that an air mattress at that point might be more suitable. However, we do need to remember that obviously as and when our patient's condition changes, that we need to reassess them in terms of their pressure ulcer risk and use your clinical judgment alongside your clinical risk assessment score as well.
And I think the other point here that it's really important that we consider the future deterioration of patients of their condition, especially in circumstances such as end-of-life care. It might be that they can start on a static foam mattress or a mattress that creates an immersion and envelopment situation, but they may need to have a pump added to that later on. So it might be worth considering a mattress that has both those functions, so you can start them on the static and then add a pump to it, so it saves you moving the patient at a later date, or even consider a mattress that has maybe dual functions, such as being dynamic and then maybe changing to the lateral tilt mode later on when the patient's condition deteriorates. So we hope that's answered your question on this part, and so join us for some more questions later.